As colleagues will be aware, we had a reduction this week of 50% in our Pfizer allocation. And even in spite of that, we're still on target to hit the 140,000 by the end of the week, which was just a really, really important target for us to hit. Now, it does mean we're essentially emptying out the buffer down to a very, very, very small level. But that's the decision we took. We wanted to make sure that we got the residential care sector done by the end of the week. And I just want to acknowledge the huge work for our vaccinator teams, for our clinicians, and for the people running this programme to be able to not just hit the target, but hit the target when we were given about 24 hours notice on quite a substantial reduction this week in the Pfizer allocation. I just want to say well done to everybody involved. As a nation, we're on a long journey together in terms of the vaccination programme, even with the great start that the country has had. As with any complex process, stumbling blocks have arisen. For example, the allocation I've just spoken about in terms of the very short notice on a 50% reduction in the Pfizer supply. I am happy to report to colleagues that the supply schedule is expected to return to what was agreed from next week, and we have indications that we will get higher future amounts to make up for what happened this week, which I think is very, very important. The AstraZeneca vaccine, which I was delighted to find out is being produced on a not-for-profit basis, can be administered more easily outside of the dedicated vaccination centres. As we know, Pfizer and Moderna have to be stored at -70 and -20 degrees. Pfizer, when you take it out of the freezer, you've got 120 hours to get it into somebody's arm. So while that can still be done through GP practices, obviously it's much more complex. Whereas AstraZeneca, still a 2-dose regime, but it can be kept at refrigeration temperature, which makes it much more amenable to be used in other settings. Ireland has secured 3.3 million doses of the AstraZeneca vaccine, as in advance purchase, and it is envisaged that its availability will really provide the backbone for the next phase of vaccination, which will include being administered by pharmacists and GPs in our communities. Plans are being progressed to ensure that vaccines can be delivered at pace as volumes increase in the coming weeks. The scale-up will be achieved through a number of partnerships, as I said, GPs and pharmacists, but others as well, and through the mass vaccination centres. Planning is ongoing to mobilise the mass vaccination centres soon, so from early February we'll see them in operation. When we receive news from the EMA about the AstraZeneca vaccine, which we expect to happen at the end of January, the date set is the 29th of January, we'll be in a position to provide more accurate vaccination timelines for all citizens. I know it's something people are looking for, and I hear that loud and clear and fully agree. Ultimately, as I've said before, we're planning our programme based on a supply of vaccines that would mean that every citizen can be vaccinated by September. So that's what we're working to. But as colleagues I know are aware, the timelines are indicative, but they hopefully will provide some reassurance and some clarity for people. But I would just re-emphasise that even these timelines, they're based on assumptions for the future delivery of other vaccines, including at this point AstraZeneca, which have yet to be approved. The other vaccines have yet to, the companies haven't even applied for approval yet. So these are tentative timelines, but I know people want some sense of where we're going and when people will get to be vaccinated.